I'm Peter Rady. I'm the Director of Operations at Medicity, and we're in the patient journey software space.
Got it. And obviously Medicity, we've had a few conversations on the podcast before and many more to come as well. It's been a while since we've caught up, Pete. What's been happening at Medicity?
So we've continued to expand out on the Ecaptus product. So we've added in a content module and a patient goal module.
Mm-hmm.
And so now, instead of just monitoring the patients as they leave the practice or the hospital, we can also help educate them, and we can also start to get them involved in their own healthcare so they can start to take ownership following the goal plan.
Yeah, excellent. I mean, that's what we talk about so often, isn't it? There's no point in implementing new models of care or innovations or anything within healthcare if it's not empowering patients and in the end having an impact on patients. How have you found this? What I found from experience is that at least in the past, it's that usually the patient experience side is somewhere lower on the priority list, particularly when it comes to the current climate of, actually it's always been in healthcare where financials are challenging and need to be able to justify a return and everything. And so how have you found that sentiment change from the healthcare systems in terms of really prioritising a good quality patient experience?
Well, it's getting the patient experience, but more and more hospitals are looking at how to get patients out of hospital sooner. Beds are expensive, and they're well over $1,000 a day to keep somebody in a hospital bed. So if you don't need to, and you can monitor a chronic patient while they're at home, there's definite cost savings in there, particularly for the governments. Everyone's trying to save everyone's trying to save money, whether you're public or private, doesn't matter. But there's also a lot of interest amongst the physicians. So specialist physicians like orthopedic surgeons, exercise physiologists we've got using it now, and they've actually all been looking for a product like this, and they want to monitor their patients, they want to gather data for research. There's a lot of researchers out there, and we've discovered there's a lot of other markets for Ecaptus because markets we never knew existed before.
Yeah.
Because it's of real interest to everybody to what happens to my patient when they walk outside the practice.
It's a common denominator, isn't it? There's only so much control you can have as a clinician when you've got the person in the room with you. It's what happens outside of those four walls.
Exactly. And when they're in the room with the doctor, they say, "Oh, of course I'm doing that, and I'm doing this, and I'm doing that." But what happens when they leave, and all the distractions of life get involved and mess up with that thought process?
Yeah.
You only think about it when you go, "I've got a doctor's appointment coming up in 2 weeks. What am I going to tell him?
Yeah.
What's actually improved?" And that's when you start to think about it. And this way they can think about it constantly, so they can be prompted with surveys, so they can be monitored. They've got their educational content, and you can serve it up in chapters.
Yep.
So you don't hit them in one go. You can do a number of chapters a day or a week, and then they're more likely to read it. You don't have to direct them to a website and say, "Oh, I'll read this stuff on the website."
Yeah.
You actually send it to them, and then they're more likely to take notice of it. And then with a patient goal plan, because the goal plan is worked out with the physician, with the clinical care team, the patients are much more likely to use it.
Yeah.
And make them think about, so how am I feeling? How am I progressing? It's got a traffic light type system in it. So when they're in the green zone, what do they need to think about? What do they need to maintain themselves in the green zone? If they start to deteriorate, they slip into the yellow or the red zone. What do I need to do? Do I need to ask for help? Do I need to look for environmental changes or check I've been taking the medications correctly and get themselves back into that green zone? And because they're thinking about it all the time, that's when you get the improvement, you get the engagement, and they take ownership.
Yeah.
And that's what everybody wants.
That's right. Well, that's something I was thinking too. Like it's so important for us to talk about and make sense in theory in terms of if we want patients to engage with content or to adhere to plans or to do stuff outside of a consult. But it's one thing to create a really flashy app or content or whatever, but if no one uses it, that's kind of pointless. So then how do you go about making sure that you've got stuff that resonates or gets used, and how do you think about these concepts of, I guess, tracking adherence or use of the platform?
Well, because as you know, our background's from Cabrini Health, from the technology group, So we work with the Cabrini clinicians to develop everything initially, but also now that we're rolling out into all these different medical practices and hospitals, every new customer comes to us with another great idea, and they say, it's absolutely fantastic, Peter, but wouldn't it be great if it did this as well? And can you do this? And can you do this? No. And they're all just opportunities to grow the product.
Yeah.
And that's why it's gone from proms and prems into a full patient journey software. And even then, new stuff gets introduced every month. And there's new releases all the time because we keep getting these great ideas and see value in it for the broader community, healthcare community. We'll do it.
Yeah, it's amazing. It's the right approach to have, I think, to listen to what those end users and the ecosystem wants.
Yeah.
You're here at HIC. Are you up on a stage or you're chairing a thing? Tell me about what you're doing.
Oh, so tomorrow I'm actually chairing a session on improving workflows.
Cool.
So we've got a bunch of different speakers coming in and talking about their papers on changing workflows and improving workflows.
Yeah.
And that's what we're all about. So it'll be great to do it. It'll be really interesting to hear.
And
so he's doing.
Yeah, no, absolutely. It's the right place to do it as well. And then thinking about what we're, obviously it's been an interesting journey as you've evolved out the product and expanded out the capability from the Ecaptus side and certainly listening to what the ecosystem needs. What's on your kind of roadmap, or what can we look forward to seeing? What excites you the most about, I guess, the future?
The future is new products. So we're starting to explore where we're going to take the next product from.
Yeah.
So we're starting to roadmap out those ideas, and I can't share that with you quite yet. That's cool. Coming down the track, but there's definitely a lot more stuff coming out of Medicity in the future.
Amazing.
So we've got an exciting time coming up ahead.